Okay, so it's not recording either, but this is the important stuff. All right, can you hear me now? Perfect. So the International Office has ordered GuardMe for students as they arrive, but there are 3 different health insurance plans that are going to cover you while you're here in Canada. GuardMe is the temporary insurance for students during their provincial health insurance waiting period. There's a 3-month waiting period for MSP, so you'll be on GuardMe for that time. Or if you're one of our short-term students here for just 1 semester as an exchange, you'll be on GuardMe for the entire semester. This is a care card or your BC MSP card, BC Services card, they're calling it now. This is the provincial health insurance, which you are required by law to sign up for if you're here for a long-term program. We're going to help you with that today. All of you here in Cranbrook, you're going to get a completed application, which Marifer has been working hard to fill in your information from your study permit and your local contact information, and you're going to review it and sign it. Those of you at our Golden Campus, we're going to walk you through the online application so you can do this yourself. Anybody at home can also stay on the call for the online application. The third type of insurance that you have access to is our Student Association Health and Dental Plan. You should be carrying these insurance cards with you at all times. You would have received the GuardMe by email. It's a little green card, and you can have a digital copy of it, but it'd be great if you can print it out and carry it with you. So here's a look at the 3 different types of insurance that apply to you. So GuardMe, as I said before, covers international students, specifically for international students, for your first 3 months in Canada until MSP starts. GuardMe covers prescription medicines, ambulance, emergency room visits, doctor visits, vision, and emergency dental. It's the 3 months. We've already determined when your end date is based on when you're eligible for your MSP. So to use your GuardMe card, many of the clinics here, well, not many, there's 1 or 2 clinics here in Cranbrook that will direct bill the insurance company. So when you go to the doctor or to the hospital, you present your card and you won't have to pay money out of pocket. But for things like your an emergency dental service, or if you go to a physiotherapist, they will bill you and you have to pay, and then you submit a claim and you get your money back. GuardMe costs $3 a day, which we've billed to your student account. So you pay it through the college with your tuition and fees. BC Medical Services Plan, MSP, your care card, your BC Services card, or PHN for personal health number. You'll see this with government forms, PHN. They're all the same thing. And that provincial health insurance, it covers all BC residents. I'm on it, Becky and Lucas are on it. We all have to be on it. And you as international students, if you're here for more than 6 months, you will be on it too, starting after a 3-month waiting period. Now, MSP only covers medically necessary services provided by physicians and midwives. So a doctor's visit or going to the hospital, getting x-rays for a broken arm or leg, lab tests or blood work, this is all covered. These are medically necessary. The COVID vaccine is covered as well, but it does not cover things that are considered not medically necessary, like the ambulance ride. So if you only have MSP, you would get a bill in the mail for the ambulance. So that's where the third insurance plan comes in to cover the things that's not covered by MSP. We'll get there in a second. With MSP, you need to present your care card at the time of service. So if you go into the hospital tomorrow, they're going to say, "May I see your care card?" You don't yet have a care card, so you would present your GuardMe card. But at some point, you're going to have that care card, and that's what you show them. You will not have to pay any bills at the hospital or the doctor's office. You will be charged $75 a month from the province of British Columbia. It's like BC Revenue Services is what the bill says. That comes in the mail or electronically, and you must pay that directly to BC, not through the college. Okay? Now, the third type of insurance is our student care health and dental program. This is through your student association, which you're all part of. This covers full-time College of the Rockies students, domestic and international, so the Canadian students as well. It covers them for 1 full year from September 1st to August 31st. But it is only automatically applied to you if you are enrolled in face-to-face classes, at least 3 face-to-face classes. So I want you all after this to check your student account and see if you see a charge for $229.50. Because if you've not been charged this, it's probably because you're in a couple online courses and they didn't automatically apply this insurance plan to you. But it's a really important plan because, like I said, when you get that ambulance bill, I think it's like $500. When you get that $500 ambulance bill to pick you up off the street when you've fell on the ice. Yep.
Kathleen, it's Karen and Gold, and Justin has a question.
Okay.
For the Student Association Health and Dental Plan, can you get family members added on to that, or is that for the student only?
Yes, you can add dependents. There's a small window of time when you can add dependents, and it's now through, I think, early October, let's say the end of September to be safe. So if you go to the College of the Rockies website and look for student care or the Student Association, you can find instructions for adding dependents to this plan. And that's a great idea because it'll cover things like dentist visits and eye doctor visits. You have to pay for those services first and then submit a claim to be reimbursed. There's also a limit. There's a limit of how much you can claim back. So your glasses, if they're like mine, they might cost you $700, but the student plan is only going to pay up to maybe $300 of that. You can see the website for all the limits. But it covers a lot of great things that are not covered by MSP, like massage and physio and travel health benefits. So please look into it and understand it. The information's all at the website. And if you have questions, ask us about it. And if you have not been charged for it, then let us know and we can get it added to your account. But there's a short time that you need to add it. You cannot opt in after a certain date. Becky, is there anything you'd like to add to any of this?
Oh, yes, one thing. Kathleen's done a fantastic job on this. I just want to let you know, you might look at this and say, well, I just will take GuardMe. You cannot just have GuardMe. You must have MSP for the GuardMe, not the GuardMe, sorry, the health and dental plan to work. You can't use the bonuses without having the base. Okay,
Right.
That makes sense?
That's a great point. Yeah. Yes, so all of these things are required. We are signing you up for the things that you must have. The one thing is you may not have automatically been given the health and dental. So we just want to make sure you don't miss out on that because it is important. And it is charged to your student account and you'll pay it with your tuition and fees. So most of you have already paid it, but we'll just double check for that. All right, there's a few more things. So what do you do when you need help? Family doctors are in very short supply in all our communities. So this can be very difficult to get a doctor's appointment. We can try to help you book a medical appointment when you're ill or if you have a something non-emergency. The good news is we have a new care clinic opening in Cranbrook in November. It will replace having a long-term family doctor. It's for people like you who are new to the community and just need to see a doctor any day of the week, Monday through Sunday, 7 days a week. It's available. So yay, Cranbrook. It's desperately needed. It's great for us. Virtual health appointments are available to all of our students who are on GuardMe. You can access Mobile Doctor. The links are available through our online orientation or through GuardMe, but Mobile Doctor and the virtual clinic, which is the same thing offered when you have MSP, the provincial plan, you can access that. In both cases, you use your phone to set up an appointment, and usually the appointments are quick, like same day, and you can talk to a doctor virtually, and they can prescribe medicine. And it works like that. You can have a doctor prescribe you medicine and the medicine's delivered to your door the next day. Or you can go pick it up if you prefer. But it's a wonderful service and I really encourage you to take a look if you're not feeling well. I know it can be scary and different to think of, seeing a doctor on your screen about your medical problems, but it's better than waiting 2 weeks and it's better than sitting in the hospital emergency room for 6 hours waiting for a doctor. You can also call 811 from your phone, and that's to talk to a nurse, and that's a free service, and they will tell you whether this is something that needs to be seen by a doctor or maybe is not as necessary. The Student Care Network, that's the Student Association Health and Dental Plan, has a network of doctors that give you an extra discount for the dental, vision, the pharmacy. So check out the website for information on which doctors are part of the network. Now, if you need emergency care, you call 911 to get an ambulance, or you go directly to the hospital. You can take a cab or a friend can drive you. But the hospital is for emergencies, and they're going to rank your injury or illness based on severity. So if it's something minor, like a broken wrist, you might sit in the waiting room for a very long time until they help the people who are more seriously ill. The hospital that's where you go for the x-rays, CT scans, lab or blood work. We also have other offices throughout Cranbrook that can do some of these diagnostic tests. Certainly the lab tests can be done other places. And so if you get a virtual call with a doctor on Mobile Doctor, they can refer you just for the x-ray. So you don't have to sit in the hospital waiting room. You can just show up for your x-ray, which is so much more convenient. For very serious injuries or illnesses, you might be sent away to a larger hospital because Golden has a very small community hospital, which is wonderful, but it is not equipped to handle the most life-threatening injuries and illnesses, and they'll send you either to Cranbrook, or if you're in Cranbrook, you may be sent out to Kelowna or Kamloops or one of the big city hospitals. For mental health concerns, if you're feeling anxious or stressed or depressed or homesick, you have a lot of great resources as international students. It's really important to look after your mental health. So you can access all of these services for free. Keep Me Safe is an app. There's a QR code on your orientation agenda. You can download the app to your phone, and then 24 hours, 7 days a week, you can chat with a counselor, or you can have a video call or a phone call. They also have resources like tips for what to do if you're feeling homesick, or how to deal with the stress of exams. It's specifically for international, well, domestic students as well, but it's specifically for students. So it's very relevant for the kinds of stresses that you're gonna face. We have a college counselor. You can book an appointment through our student services page at the website, or through go to the student services desk upstairs. And the student care health and dental plan also includes counseling. I don't know anything about it. We would recommend Keep Me Safe, because Keep Me Safe is used to working with international students, but Empower Me may also be a good option for those of you who want to try that. It's a Canadian service. All right, here's a quick video if this works, and then we are done. All right. Oh, no. Let's go. Okay. So we really, really recommend that you put the app on your phone now when you're not in crisis, right? You're still feeling good, things are okay, and not, when you're feeling down, you come across the app and you say, yeah, this is something I have access to. It's here ready for me. Don't wait, just so you can scan the QR code, download the app, and you've got it when you need it.
Kathleen, we have a question in Golden.
Wonderful, thank you.
Is The Keep Me Safe program, does it extend out to family members?
So the students need to enroll their dependents themselves. So yes,
great.
it can be extended to family members, but they have to do it themselves. They should have received their GuardMe card. If they don't have one and they're in Golden, they need to contact the international office right away. And then once they have their card, there's a phone number on there and they'll have their policy number and they need that in order to enroll their dependents.
Great, thank you.
Yeah. And the dependents are actually slightly less expensive than the cost of the student. The student will be the primary person, and then you get to add dependents for a little less money, which is nice. So as I said, we were going to walk the Golden group through the online application after starting at 12. Our paper forms are not here yet, so we'll take care of those at a later session. That's no problem. Just be aware that your MSP, your health insurance, expires when your study permit expires. So if you're extending your study permit, you will have to apply to extend your MSP health insurance by uploading the new study permit when you get it. It's a very simple process, but it's one you may not remember to do. So we try to send out reminders. Just be aware of that. Your social insurance number, I mentioned earlier, also expires on the date of your study permit expiration. So you would go into a Service Canada office with your new study permit and ask them to extend it. You can continue working on your social insurance number as long as you've applied to extend your study permit. So your social insurance number is also continued. It's considered to be like maintained status as long as you've submitted the application. So that's the end of health and dental and health and insurance. We have with us, I'm going to stop sharing. Some questions. Perfect. Absolutely.
College health plan.
Yes.
That we were covered until end of August, but can you confirm that if our program is shorter, does it stop with the end of the program or it stops with the end of the study permit? Like we can be still covered?
You're still covered for the 1 year, and it's not very flexible. So, if you're starting in January, there's special rules about how to start your insurance later, but it's covered from September 1 to August 31st, whether or not you're a student. That's a great question. Thank you. Any other questions? All right. So, we will, we'll let you finish here. Here in Cranbrook, we're just passing out a few things.